Hi everyone, I am Tara, aka Spirit Mother, and I would like to welcome you all back to my channel on YouTube, Spirit Going With Itself, on TikTok, 1974 Light Soul, and I'm also live on my Facebook. If you're new to my channel, I always recommend, suggest, and really encourage you to read the description on my YouTube channel, Spirit Teachings Going With Itself, to get a better understanding of what it is that I'm doing forward. And as most of you are aware, I do use a lot of my own life experiences and bring them forward. And today is no exception. Earlier, I was going to come in and talk about Mary Magdalene, and Jesus. However, Spirit brought me somewhere else. Right? Spirit brought me to my therapy appointment today because I went to my therapist. Okay, and well, I called this morning, left a message, and it wasn't until later, and I seen that blink. It wasn't until later that I got a call from my therapist because I thought I had an appointment today. Now, called and asked me about one of the psychiatrists at the hospital coming in and, meeting me. Okay. So, I was like, Spirit was like very hesitant, right? Because I could feel that right off the bat, like something wasn't right. Something didn't seem appropriate. Something was off. But I was like, okay, because I thought it was just a meet, just to come in and meet, not to really have a conversation. Okay. So we were sitting there, and I was explaining. He was asking me questions. I was explaining things to him. He told me I didn't answer his question, which I actually did, because he asked me how it affects me when I help other people. And I had told him I just transmuted. But he told me that I didn't tell him. Okay. But see, the first thing he addressed when he came in the room, he's not my psychiatrist. And he just wanted, I was told he wanted to meet me. Now, the first thing he brought up was, I see you've been in the psychiatric unit both 5 times. Okay, which left me kind of confused. And then all of a sudden, Spirit had me sit up. Because Spirit knew what was coming, and then he said, like, I was reading about how you say about these, you have gifts or abilities. Okay. This is where a breach of trust comes in. My ex-husband asked me, well, like, what are you going to do now? What are you going to do? I told him I don't know. Because sitting here, and Spirit had me, before I was coming live, Spirit had me like sitting with today. Right? With what transpired today. Because that told me, he read my file. He was reading my file. Because he even said that, he was reading the file. Okay. Keep in mind, he's got nothing to do with my medical health. He's not my therapist or nothing. Or he's not my psychiatrist or nothing. I have nothing to do with it. So Spirit had me do a little bit of research. So I went on the Google and I asked, is a psychiatrist allowed to read your file? Oh, come on. I had it. Okay. Is a psychiatrist allowed to read your file if you're not seeing one, but you're seeing a clinical therapist? Okay, because I'm only seeing the clinical therapist. I'm not seeing a psychiatrist. I'm seeing the clinical therapist. Take your 51st date shit out of my room because you're not welcome here if you're going to be doing that. Generally, a psychiatrist is not allowed to read your therapy file without your written consent if they are not actively treating you. But that's what people don't know, and that's not, they did not inform me. So there is a breach. They knew. Because I was called at 12:30 to come in for an appointment for 2:30. So he read this long before that, which legally speaking, he had no right to be reading it. Okay, treating you, as mental health records are protected by privacy laws, HIPAA in the United States, PHIPA in Ontario, Canada. Only healthcare providers actively involved in your treatment can access this information. You're busted. Hey, he was looking at you don't like when people do not believe me and realize that I'm feeling your fucking energy while you're sitting there because spirit is the one reading you. You are trying to deceive spirit. You're deceiving me. And in that appointment, after the psychiatrist, I was talking about lying by omission. So I will be having a conversation with my therapist because I told him today that right now in the medical community, right now, he was the only one that I trusted, and I'm still reserved on that. And he has a web, and the blue light was on. So only healthcare providers actively involved in your treatment can access this information. So he went into my file, the psychiatrist went into my file and read it when he had no right to be in there. Key details regarding this situation. Now here, we'll go on. Consent required. A clinical therapist must have your permission to share records even with other professionals. I didn't sign anything. So right there, my patient rights were violated. This is stuff that people don't know. He's not my psychiatrist, and I could read I could read the body language. I could read the eyes. Seriously, you take me for a fucking idiot. The whole time I was sitting there, when I'm sitting there and I'm like this and watching, and all of a sudden, spirit hears something. Spirit will take me and put me like this. Just like Okay, let's hear what you got to say now. So he read my medical documents, which he had no legal right to do because I never gave consent. And he's not my psychiatrist because I don't have a psychiatrist. I have a clinical therapist, and it's through the hospital. So, active treatment expectation. If the psychiatrist is part of the same clinic or team actively managing your care alongside the therapist, they may have access. Well, he's not alongside. I mean, they work in the same place, and they you cannot share. We'll say, well, that says that they can because if they're in the same office, they still can't share because he's not the psychiatrist is not involved in my ongoing therapy. Am I resistant to therapy? No. I've been going to it for a year and a half or 2 years now. And I've been explaining the same fucking thing over and over again. And they've been witnessing and real like, you wanna you still wanna play that fucking game? Because after the psychiatrist left, I told the therapist exactly what I was getting from the psychiatrist. Because even the demeanor of my therapist changed. If you have to breach trust, then maybe you shouldn't be working with those people. The psychiatrist wants me to come meet with a couple sessions with him. They're blowing it out, like it come out of my mouth about what to diagnose me or to try to diagnose me. Chiedete pure che lei sarai. Mia kopo borosharata turisti creando no? You're really gonna blame this on mental health? You should like, if you're gonna do this to people, you really shouldn't be in that field of work. Active treatment confidentiality limits. The only exception to the rule is if there is an immediate threat of harm to yourself or others. And there's no threat or harm to myself or others. I think it's because of what you see on my videos. I'm not causing harm to anyone. You might be getting butthurt and pissed off at what I say. But I'm not causing harm to people. I'm telling people, do not harm yourself and do not harm others. Even if I do say, sometimes my ex-husband needs it. With all due respect, I'm not knifing people. And I might say it, but I don't do it. Do I say that somebody needs to give him a good punch? Yeah, I do. Hey, you're talking about hanging people, right? Shooting people point blank. You're fucking showing that shit on the internet. You're showing people being shot point blank on the internet. If you are not currently seeing that psychiatrist, they have no legal right to view your records. Ay, no, que desatana todo, güey. You know, for the dirty century that got played on me today with regards to that, you're both like both my clinical therapist and the psychiatrist has legally violated my privacy rights. But the family needed it. I've had a read, and I know that the psychiatrist even said like you would make a good therapist. Told me I would make a good therapist. They probably did not, because I didn't go to school and take years of it. I just lived the experience. So people wonder why I do not trust the medical community. I do not trust the justice system. I do not trust the educational system because whatever they do with regards to your medical records, it follows you through education, it follows you through the justice system, it follows you through your family, it produces a stigmata, and then they share the records. So that just goes to show that they are illegally sharing your records with whoever they want without your written consent. Am I saying they're all doing it? No, but this is a prime example of what they did to me because I didn't give permission, written or verbal, for him to read my records. Now, let's go to the next thing because I'm ordered another. Next thing. Okay. Is your clinical therapist allowed to share your records with a psychiatrist who is not treating you? Generally, a clinical therapist is not allowed to share your records with a psychiatrist or any other provider who is not actively treating you without your explicit written consent. Privacy laws like HIPAA, well, and the one in Canada, which is PHIPA in Ontario, Canada, and ethical guidelines ensure your records remain confidential, protecting you from unauthorized disclosure. This was unauthorized disclosure. So that's how, that's why like certain that's how you get tagged, or you call it flagged. Because see, the thing is, you go into a hospital, you didn't like, okay, that you could say that that kind of falls under who's treating you. depending on what you're there for, right? Because they will hold your mental health against you, even if you're in there for something physical. I know because I experienced it. I was in for physical, but they kept telling me it was anxiety, it was mental. But it was actually physical. And I ended up dying at home because of the negligence. But the psychiatrist didn't believe me enough. And with all due respect, which you deserve none because you showed me none. This is why people don't go to therapists because they don't trust you. It's not because they're paranoid. It's because you give them reason not to trust you. But you will speak of breach of trust. So true breach of trust falls on the patient towards the doctor treating them. That's who breaches trust most of the time is the doctor, not the patient. Key points regarding this situation. Requirement for consent. Your therapist must give you permission. Oh, must give you. Your therapist must get your permission to share your records with anyone not directly involved in your current care. That psychiatrist was not involved in my care. Never was he. But I do know that as I see him now and spirit shows me and takes me back to one of the times when I was in the psychiatric unit, he was the psychiatrist that seen me with the students. But that was 5 years ago. He was never my psychiatrist. He was only the one that seen me in the hospital. He never seen me outside the hospital. He was the doctor on duty at the psychiatric unit. Like a great, when I heard the last name, it automatically took me to Dr. Alan Abbas at the Center for Emotions and Health. Wasn't him, but it was much the same. You look down on people. He looks down on people because you think because you have a 5-year, 10-year education and so many years of therapy and doing psychiatry and passing of medication that you know everything. You know, I don't want to see you with a clinical setting. You want to be serious and have an intellectual conversation with regards to how spirit and mental health are connected, but not in a medical setting. Not where you're going to sit there and fucking analyze me and try to diagnose secretively. Because it's trickery. Because you were trying really hard to get me to go see you. This is the spirit to spirit, and the spirit knows who I'm talking to. And, I do know they watch my stuff. But people say, oh, yeah. And if people think that they're not watching your social media stuff, if you're involved in mental health, then you really need to wake up now. Because, in a medical setting, legally, if they're recording you, they're supposed to let you know. So you take me for an idiot. You took me as not intelligent because it's written all over a file, mental health. He even said about all the labels, all the diagnoses on me. Seriously, I owe you no respect because you showed me that. Purpose of sharing, even if the psychiatrist is involved in the care, sharing usually requires a signed release to ensure community and your choice what information is shared. Wait, they shared a bunch of my information, and I never had say over what they could share. So there's another violation. Ti secreto vremo creato, noi, eh? Disse que tu poderia. I've shared my story, and it's like, what, you want me to go in and share my story so you can flip it, manipulate it, and try to use it to your advantage to try and get me signed into a psychiatric unit so that you can say, oh, well, I had a conversation with her and she's not mentally stable. You violated privacy guidelines. You're trying to trick me, which you'll say that's a paranoia. I already told her that, I just want to sit and have a conversation, like to talk. You kind of tell me your story and then you share a bit, and then maybe I can share a bit with you. I wasn't born yesterday, and I do know how the medical system works because I've experienced a lot of suffering from the labels and disorders you put on. And you call yourself doctors. Last I knew, doctors actually helped people, not like for personal gain. Purpose of sharing. Okay, choose. Okay, exceptions. Confidentiality can be broken without consent only in specific legal situations, such as court orders, mandatory report of abuse, or serious threats of violence. There was none of that. You may portray things because my body jerks and jolts, but that's you actually energetically going after me. It's that part you don't like what I have to say because it goes against what your rights. You have the right to know who has access your records and to revoke consent for information sharing. I never gave consent for you to share it, for my clinical therapist to share with anyone, not even my family doctor. Because I don't even go really to a family doctor. I've been to a doctor, well, not including the hospital, for a few months, but I've been to the doctor in the past 5 years, maybe two, maybe twice, 3 times at the most. And it wasn't for anything big. But see, he even sees and treats me poorly because he'll send me to mental health. Do you think I don't know that my file is flagged? Do you think I'm that incompetent and fucking stupid? That's what they do to you. That's why you can't get that. That's a lot of the reason why you can't come out of that mental health rut. I'm not saying they're all like that because there are actually good therapists and psychiatrists out there. But if the first thing they want to is to give you a pill and to psychoanalyze you, that's not for good. If you believe your therapist shared your records without authorization, you can ask for a copy of your records and file a complaint. Probably even if I went to a lawyer and brought this up to a lawyer, they'd probably dismiss me on it because, like, you'll do that because, you know, it's always, I got to check to see if it's a conflict of interest. And, usually a lot of them are actually being picked up by the government. So it's usually always a conflict of interest. And you're lucky if it's not. But by them doing what they're doing, that's actually causing damage. So it's actually a civil list. Now, I asked it another way. Just, hey, they always say about cross referencing, right? Oh, certain things must make you sad. And then they get almost irritated when you say, no, not sad. Because it's sad for the people who's putting this shit on you. It's sad for the people who feel like they have to have somebody else feel pain so that they feel good about themselves. So no. And I even told my therapist, no, it doesn't make me feel sad. It just irritates me. Que la tutore. Que se mo tota and yo look at that, I'm like, the church did it to the female. And I will say the church because they did it to Mary Magdalene. So I rooted it If a psychiatrist is not treating you, but they have access to your medical records, are they allowed to read them? Generally, a psychiatrist who is not treating you is not authorized to read your medical records, even if they have technical access to the system. No, goddamn fucker. Hey, with all due respect, which you deserve none because you showed me none, you're the one in violation, not me. And to the ones who stand behind them and agree with what they're doing to people, you too should be held accountable for what happens to people. That's why people unalive themselves, take their own lives. That's why people fucking kill other people or beat the shit out of other people, is because of people like yourself. I'm talking to therapists and psychiatrists who are like that. Am I irritating? You're goddamn fucking right, I'm irritated. And I have every reason to be irritated. Because you violated my privacy rights. The last time I had that happen was back in 2008 when I went to my family doctor and asked her to send me for a PET scan, which was no coverage to them because I was the one paying for it. No, you don't need that. So I went to my medical therapist. I told her, like, hey, I won't be able to see you because I'm going to Alberta to go get a test because my doctor wouldn't send me for it. So I have a doctor in Alberta who is going to sign the requisition forms for me to go do it. So it was like confidential. There was no immediate threat. There was nothing. It was someone going for a second opinion. Well, when I got back and I went to my doctor's office to show her the results of the PET scan, I'm not going to be your doctor anymore because it's a breach of trust. Yeah, you're fucking right, it's a breach of trust. It was a breach of trust with the doctor, and it was a breach of trust with the therapist, because it was the clinical therapist who had told the doctor. So I went to the clinical therapist and I cried right in front of her because I actually trusted her and I liked her, but she breached my trust and I wanted nothing more to do. It's people like that you should not be in a position of working with people if you are going to cause them more damage and more pain and suffering than you are helping them. Because at no point was there any call for that to help. There was no immediate damage, immediate threat. So let's read that again. If a psychiatrist is not treating you, but they have access to your medical records, are they allowed to read them? Generally, a psychiatrist who is not treating you is not authorized to read the medical records, even if they have technical access to the system. Medical professionals are restricted to assessing information only when directly involved in your care, payment, or specifically permitted administrative duties. So he was not allowed to work, and he was not allowed to give the documents to in order to work. Both of them in breach. One in breach of trust and in breach of a Privacy Act. The other one in breach of the Privacy Act because, hey, As a professional, you're not supposed to follow the guidelines like you tell everybody else they're supposed to. You're not an exception to the rule. Because you're saying you wrote a diploma or a certificate or a bachelor's or MD or what you may perceive you have. And like I said, not all of them are like that. There are good ones out there. Key details regarding access. Need to know basis. Access to a lot of electronic health records is governed by strict privacy laws with the PHI, whatever the other one was for Canada, Ontario, or provincial laws in Canada that limit viewing the treating clinicians. Unauthorized access is snooping. You're fucking snooping bastard! You know, hey, you'll say I'm psychotic. I'm well aware of everything that's happening. I'm well aware of it all. I'm allowed to be upset. I'm allowed to be frustrated, irritated, and angry. But you'll write that down as a mental health issue. Because the only way he would know that I had a multiple uh, mental health disorders, diagnosed as mental health disorders, would be if he read my file. And according to all this, he legally violated my rights. He committed an illegal act. If we were to do that, we would be held accountable. Unauthorized access is snooping. Assessing records without a professional clinical reason is considered unauthorized snooping and can lead to termination of employment. Let me read that again. Unauthorized access is snooping. According to assessing records without a professional clinical reason is considered unauthorized snooping and can lead to termination of employment, legal action, and significant fines. You had no reason to be in my file. And my clinical therapist had no reason to give it. You know, you did say that there was a few others of your clients that you did the same thing with. Did they give consent for that therapist, that psychiatrist to read those records? People say, you just want to destroy people. No, you're destroying them. Well, you know, you probably, because, you know, oh, she's got mental health issues. Don't listen to her. Don't listen to her. Like, don't watch her. She's fucked up. She's fucked up. Don't believe a goddamn word she says. Expectations. Access might be permissible for authorized quality improvement activities, teaching specific legal matters, but not out of curiosity. And that's what was basically done. curiosity, because there was no medical reason for me to be looking. Because I said I wasn't going to a psychiatrist, but you tried to sneak it in. You tried to trick me, and then you tried to force it on me and say that you were giving it up because you wouldn't stop trying to push it. If you believe a psychiatrist has viewed your records without cause, you have the right to ask for an audit log of who has access to a file and file a complaint. Well, it even says, legal matters can be taken. Use termination of employment, legal action, and significant fines. This is mental health. This is stuff that, they're going and they're passing on and they're flagging you. And once they see that flag, that's when they treat you poorly. So my clinical therapist and the psychiatrist both violated my rights. And my clinical therapist was a breach of trust. It didn't clue in on me because I didn't even know that he read my records. And even when he said about the psychiatry, like the psychiatric unit and all the disorders they diagnosed me with, it still didn't dawn on me until Spirit had me sit with it. So thank you, Spirit. At least you got my back. Maybe there should be a class action lawsuit against the, especially if it's if it's done through the hospital. Class action lawsuit against the government. And, they're paid by the government. Oh, wait, shit, man. I forgot. Like, Dr. Robert Williams or Dr. Robert Miller from Nova Scotia had an article in the Chronicle Herald back around March 24th or 26th. Sorry, beginning of March, Actually, I'm showing the 3rd of March of 2020. 3rd or 6th of March of 2020. And he said in there that the biggest majority of your healthcare money goes to a fund to protect doctors from medical negligence and malpractice. That's why they can get away with it. Because the patient has no backup. And most patients going through it, they don't have the money to fork out to pay for a lawyer to take it to litigation. And when something like that has happened, fuck. Please, I can't know that. You must live today. I even let's go to this. Consumer medical records. Steps to justice. The Guide to Law in Ontario. Steps to Justice. The Guide to Law in Ontario, which, is pretty much the same standard. Who can see my mental health records? There are many reasons why you, a healthcare provider, may want to share your health information. Okay, well, that's not what I'm looking for. Your healthcare information, including information about mental health, belongs to you. In most situations, your healthcare provider, for example, your doctor, psychiatrist, or counselor, cannot share your health information with anyone who isn't treating you for a health issue. Right to law in Ontario. So let me read that again. Your healthcare information, including information about mental health, belongs to you. But you have to, it belongs to you, but you have to go to the Freedom of Information Act in order to get it. That sounds a little fucked up, right? It's yours. About mental health belongs to you. In most situations, your healthcare provider, for example, your doctor, psychiatrist, or counselor, cannot share your health information with anyone who isn't treating you for your health issues. So my counselor should not have been sharing my records with a psychiatrist, nor should the psychiatrist have been going into my medical records because you should know, right? But somehow it's always the mental health patient who don't believe them. Like they're very uneducated and they're this and they had mental health issues since they were little and this and that. And then if people had health issues from the time they were young, my question is, or my statement to you is, then I guess you're not doing your job properly, are you? You're not doing what's in the best interest of the patient. You're only doing what's in the best interest of your pocketbook or the best interest of your namesake. Got to write that doctorate, right? Got to have those statistics. If your healthcare provider wants to share your records with someone else, they must usually get your permission. For example, if you're sending your information to an insurance company, even when you want, they even sent that to, like, yeah, that ended up in my insurance when I had my accident in 2006. That ended up going to my insurance company. But I had a car accident, so that didn't need to be there. Get up through it. Even when you want to share your health records, for example, with someone helping you with an insurance claim, you still have to give your healthcare provider permission to share your records with that person. So you have to give your healthcare provider permission to share your records. The psychiatrist was not treating me. I had no fault with that psychiatrist. There are different ways you can give permission to share your health records. Step one example, what they are. Sharing without your permission. Let's see. There are some situations when others can share your mental health records without your permission. This can happen when, for example, your healthcare provider needs to share information with another healthcare provider who's involved in care. You're badly injured and your healthcare provider needs to speak to your loved ones about treating you. There's a risk that you or someone else could get seriously hurt. There. You're detained at a psychiatric facility or jailed against your will. Because if they can get you into a psychiatrist, then they can try and say that you are not in a place of being able to make appropriate decisions for yourself. And this was tricky because I am capable of making decisions for myself. But you'll try to say I'm not. Good, I thought I didn't see it. If your doctor is checking to see if you're mentally capable for the consent and capacity board or the public guardian interest. They're really trying hard to go after people like myself. And there are many people like me. Because they want to say, look at their mental health record. Just remember, I went there voluntarily. And I'm capable of making my own decisions. Because I'm well aware of what I experienced, what I went through. And as far as going to the clinical therapist, it gives me someone to talk to. And it, gives me the place to, kind of get them to understand what other people are actually going through. But I'm a threat to their friends too. And not only am I a threat to the pharmaceutical, but, it's seen as a threat to the medical system itself. But she'll tell people she's paranoid. You deserve to lose your license, just so you know. If you have a subdural decision maker who's allowed to make healthcare decisions for you. Complain. If you think someone shared your medical health information when they had no right to, you can complain to the Information and Privacy Commission of Ontario. Step 5 explains how you can do this. Information and Privacy Commissioner of Ontario. Access and privacy rights for all Ontarians. This is pointing it out because, it's really pretty much the same here. Play a vital role in ensuring that the very cornerstone of an equitable digital are a solid construction built to support the weight of Make a privacy, it says file an appeal. You have the right to file an appeal to your office if you're unsatisfied with the decision. Okay, so make a privacy complaint. If you think that your your personal information has been improperly collected, used, or disclosed by a public institute, child, family services provider, or other health sector organization or practitioner, you have the right to file a complaint with our office. Report a privacy breach at your organization. Get information about how to manage and report a privacy breach to the IPC. You know, this is why people can't. If you even try and question a system, it will try to deem you incompetent. I know a lot of people get butthurt by what I say, but I show you the research that I do. You'll get offended for what I bring forward with regards to the Bible. It's like, holy shit, man. See, the church says about possession, about the spirit realm, paranormal, and what have you, but then the medical system fights it. So, hey, saying that everyone in the church is corrupt. I'm saying that the church has been mishandled. I actually liked going, just sitting at church until I started hearing them say about that. It's like, it's okay to kill rich people because you're rich. If you're going to be a therapist or a psychiatrist, you're not going to understand spirit. Because spirit, that's the part that affects me. And you do. You keep people in that mental health loop and then say you're overworked and underpaid. No, you're overpaid for doing a job that you're not doing correctly. Just to throw everything away. You are the darkness. And in all honesty, I can't blame my ex-husband for not wanting to go near them. Yeah, he can be an asshole. And, it is like he's working through a lot of multiple personalities. But I know every time that he's going to the next. So do I take the shit? Do I come on here and say about it? Yeah, because it's spirit to spirit, because I'm not talking to you. I'm talking to spirit. I'm talking to the shadows. And when I mean the shadows, I mean the traumas. I'm talking to those parts of people that you've been struggling with and trying to go up against or ignore and avoid. But how dare a layperson go up against somebody who's got a 5 years or 6 years of university and then fucking 20 years of psychiatry? Why don't you share your experiences with us and see who got more knowledge just because you read out of a book and you go by statistics? How about going by experience? Because experience knows more than book. Because of experience. But you will make people feel bad for their experiences. Just say to people, whoa, whoa, oh, oh, we'll make you feel even worse because we'll diagnose you and we won't tell you what we diagnosed you with. And then next thing you know, you get 100 fucking diagnoses. Holy shit, man, I'm a fucking bag of hammers. See? So I think today was the last day because like that was just like, after me sitting there and put my life to my face, I wish I was talking about my condition. You don't give information to make a person make an informed decision. So I'm glad I had spirit guidance. But you'll say that's psychotic. You'll say it's deep possession. Stop reading your fucking Bibles because those are prophets, those are psychics. And they speak tongues. Go Google which ones of them spoke in tongues. Because Mary and Jesus did it too. Right now I have so much screaming internally because it's sitting with the betrayal. And betrayal is the hardest of Muslims to face, especially when it comes from the people that you put your life in the hands of and trusted. But you'll call it a paranoia, right? Just look at it. So, when I'm in the office, I know you, but I'm pretty sure you're recording me because every time I look over, and that blue light is on. And when the blue light is on, that usually means that you're recording the person. And we used to have a computer so that it was situated and I could see the screen, and now it's kind of turned angles. But the camera isn't. I can minimize my YouTube and my Facebook. I can minimize what I'm still on because I haven't turned it on. because you don't understand what I'm saying. If people's family doesn't say for them, people got butthurt because I brought my story forward, and they just happen to be involved. But like I said to my therapist, hey, you like to go watch documentaries as long as it's about somebody else and you're not involved in it, right? Because you like the gossip. You know who's not on the unseen player? Because I looked. RF. Does he have a past? Yeah, don't know. But there is a lot of stuff that he knows what he's talking about. You know, I'm just sitting there. Mental health has caused me more mental health problems. Your pain is different. In my life experiences have ever done to me. It's just say, oh, she's depressed. No, I'm not depressed. I'm not stressed. I'm just kind of speaking up for myself. I'm finally standing up for myself, and you don't like that. Yes, I'm right. Yes, you know what? I'm going through this. I chose to connect with spirit and go through the hell that it takes to get connected with the spirit. And what other people myself. And that means the biggest majority of the population because we're all going through something, some more than others. People don't know it's right. And so you got butt hurt. Your ego got bruised. It got bruised by a woman who had grade 8 education with lots of fucking life experience. But I did take that. I went through it. I went through the whole life with the lawyer. No, but I do know the basics. And I do know how to be professional. Because the lawyer that I had before he passed, he was with me all the time. Spirit. And he was frequency. But he was good. He was black belt. Because he wouldn't be part of the cooks. Maybe he was. I don't know. But it was my grandfather who guided me to that. And I did inherit all of his law books from the time he started law in 1965. I had no place for them, so I took $40 as a donation. I got $40 for an entire legal library because I wanted those books to go to somebody. The best way to learn is through experience and a lot of self. I know my oldest son, my parents adopted, and my youngest son, they do the work. They learn by using social media, YouTube, and stuff like that. The see these therapists who will not take the time to go on and look at people's lives to see what's really happening without your fucking diagnosis. But you would still try to diagnose it. I really doubt that I will be able to trust another therapist. But they'll say it's paranoia and say, see, she needs psychiatric help. With all due respect, you're the one who needs psychiatric help because you need your ego boosted. And this is spirit to spirit. So please, if you're a good therapist and you're doing what's right by your patient, then I'm not talking to you. That's why I said, people really need to start like this. Like I know you're putting all this stuff out there to make people aware, but how about you use your own voice of what you experienced and what other people experience? Let them come forward and share their story. They're sharing it through the files, but what they're actually keeping you from looking at is yourself. You're too busy looking at the files that you don't have time to look at your own life. your own life experiences because it's always easier to direct it. It's always easier to direct the mind somewhere else opposed to where it needs to be. And in order to heal, you need to focus on you. The rest is already basically done. It's a part of like knowing who your enemies are and who friends, family, co-workers, medical community, justice community. Are they looking at what's in your best interest, or are they looking at what's good for your ego? Don't let that ego get butthurt because if their ego gets butthurt, they're coming for you. Good as they say. So you don't play fair, but you talk about fair. You know, I'm at that point where, some people only want something to do with me if it's something that they want. But when I do something or what have you, well, they're never around because Tara's got a soft heart. People say love and light. I've been looking for that love and light. I have love, but a lot of what I see in front of me is a lot of shadows, and they don't belong to me. Even when I said about shadows, we don't in the psychiatry world. You have a fucking clue what people mean by the shadow work. The shadow work is the traumas. The shadow work is the deep memories. The stuff that's burned into your fucking brain and it wants to run and hide because it doesn't want to see it anymore because it's too painful. But you can't struggle to get anywhere, struggle to move forward. And it's like you're just stuck in this because it weighs you down. So, with regards to mental health, there's not really a lot that I can do or any advice that I can give you, especially someone who went snooping in my file and got illegal access to it. See, I like, you know, narcissists hide in the medical community, the justice, the educational community, the religious community, the spiritual community, because the spiritual community is no exception to the rule, because the spiritual community is still doing the same thing. It's a cutthroat. Like I can, when I look on here and I can tell when somebody is genuinely sharing a story because I feel it through them. It's not that I feed on good or bad as energy because I don't feed on your energy. I have plenty of my own. I experience your energy. I help you to transmute it, but I will not hurt. I will not carry someone else's cross today, nor the weight that it entails. I will help you just by sharing my story, by talking to you, you know, asking you the right questions. It's, you know, what would I want somebody? How would I want somebody to help me? See, I was sitting there, and that psychiatrist was sitting there trying to diagnose me while he was sitting there. Dude, what did I say something on my video that stirred you guys up? She'll say, oh, she's paranoid. No, I'm not paranoid. I'm just stating the obvious. And you're denying it. Elemento para yo las dejas hacer ruido que tengo que darle. Sitting there and asking someone how to make you feel, oh, but most people say that. You know, most people say that. Seriously, fuck off. Seriously, you're patronizing. And that's how you feel. So when you do that, I can actually feel the energetic hits because you want me to feel that way. It's like a curse. Or sorry, it's like a spell. You're a bread and butter. So if you look at people as if they're your bread and butter and you don't want to try because you know And it said in there that, it could invoke termination of employment, legal action, and significant fines. Do you know I had a family doctor who actually had their license suspended because they filed their documents wrong, medical records wrong? Sorry, but I'd rather go to a natural path because they're not trying to force medication or diagnose them so they can figure out the I've heard so many people that, people don't want to be around. That's fine. I guess truth hurts. My own truth hurt because it was truth that I didn't want to face myself. But I didn't face them by going to a psychiatrist or a therapist sitting there while they're trying to psychoanalyze me and feel me and to say, oh, well, that was a hard or that must have been sad. Is that what she went to school for? So you could sit in an office and say to somebody, oh, well, that must make you sad. Watched the thing where a pastor had said that, they stopped being a pastor because he didn't go there to be a psychiatrist and everything like that. But hey, that's part of it. You teach about what Jesus and Mary Magdalene. Oh, wait, no, not Mary Magdalene because you took her completely out and called her a fucking whore. But you talk about what Jesus would do with the people, but you're fucking complaining because you're not only going up on a podium and saying 1 day a week. When I was taking up religious studies, part of it was the counseling. You could be different things. Don't sit there and fucking preach to me about God. Don't preach to me about all the fucking bullshit that you preach about and telling people that they're sinners just to make them feel bad so you can feel good. I believe in God more than you do, and you preach about it because it's not about God. It's about the Holy Spirit, and the Holy Spirit is who I worship, who I look to. And I don't worship because the Holy Spirit doesn't want you to worship or expect you to worship. Just people do. Am I angry? You're fucking right. And I have every right to be, but you're going to take that away from me too, right? You think I'm a muscle. This is why you have to hide behind your fucking compartments. Because you destroy more lives than you help. And then you call yourself a doctor. You call yourself a professional. Yeah, you're a professional enabler. You're a professional needs your ego stroked to feel good about yourself. And it's not all of you. The ones I'm talking about know damn well who they fucking are. And there are two of the ones that I've seen today. But I'm the problem, right? No, I'm not the fucking problem. You are. The patients aren't the ones. Yeah, the patients aren't the ones who breach the trust. You are. You're the professional, so-called professional, but you're not very professional. You just carry a label that I have to ask, or I have to say and ask, like, you know, did you get your license from a Cracker Jack box? Oh, wait a minute, I thought they got stopped. I thought they stopped giving those out a long fucking time ago. Did you go to the Trump of Donald Trump or the school of Donald Trump? No offense, Donald Trump, but you say you have a unity, like there's a university for Donald Trump. The Yale, well, you're finding a bunch of shit that went on there. Did you get your butt hurt because you weren't in with the popular people? Or, were you suck hole into the professors? I have to be angry, and I really encourage people to get on these social media platforms and share your experiences with the system, even if it makes you look not so great, or you're worried about what people will think about you afterwards. Stop worrying about that, because all you're doing is hurting yourself. To stick it out that way. So at 2 hours notice, Skipper was preparing me for it, because Spirit knew, because prior to going, I used this, and I was asking Spirit if it was a trap. People say, why would you go that way? I already knew what Spirit was telling me. I don't need you. I didn't really need it to do it. Spirit was to help me, but apparently you're not. So I'm not a coach, but I'm still here to teach others how to apply these things and how to come out of that mental health loop. Patients are not the problem. Your therapy is. And if you're butthurt over that, then I guess that means I'm right. You know, one thing that I do at my school, and it was pretty nice to told me, sometimes you have to speak language. The thing is, when you speak the language, they hate it, because it shows them who the truth. So that people of mediocre, mediocre ability sometimes achieve outstanding success because they don't know when. When you quit, it's that part of giving up on yourself. The ultimate measure of a person is not where they stand in moments of comfort and convenience, but where they stand at times of challenges and controversies. Great opportunities to help others seldomly comes, but small ones surround us every day. It's like the art, and I hope Morgan Freeman said it on art represents art for kindness. Give me a lever long enough and a prop strong enough, I can single-handedly move. And it's unbelievable. You know, I'm going to leave it there. You do what you will with this. But I do encourage you to share your story. You know, even if you figure that people are going to look at you one way or another, it's your story, not theirs. Maybe they're involved in it, but it's what you went through, and they can't take that experience away from you. But you can help others by sharing it so that they know them and they can see that others do understand. So with that being said, I'm sending you on a chill flight. Many blessings and support you very good health to anyone and everyone who wants to know to receive and accept. I want y'all to be grateful for you support you for yourself. Be your authentic self. Be true to Christ yourself. Be who you are, not who somebody says you are. You are stronger than you are given credit for. And you can overcome any obstacle if you really want to. It's time to heal. And you remove the guilt.